which can occur on the outside of the arm. This is often due to improper biomechanics, such as tossing the ball too far forward on a serve, and then the extensor muscles get overstretched. This also happens with a ball too far in front on a volley, and the impact that can occur on a one-handed backhand. Sometimes the tennis elbow area is very inflamed, and some of the traditional approaches to taking care of it just take a very long time. And I want to share today a technique that I found unbelievably effective and very simple. It was invented in the 1950s by osteopathic Dr. Jones, and he used the method of strain counterstrain, or SCS. I also will refer to this sometimes as positional therapy. If we can imagine this band here as a muscle, when we think of yoga, we often think of stretching and taking the two ends of the muscle farther away from each other. With strain counterstrain, the two ends of the muscle we actually will take closer together, and then you can see that the muscle goes into a slackened state or a relaxed state. And this is exactly what we'll do with the extensor muscles of the arm. If you touch an area on the outside of the arm and you feel that it's tender to the touch, this is an area that we will shorten. On most people, these extensor muscles are too long, and they can be aggravated by things other than tennis as well, such as simple activities like typing. What we do is take the hand, bring it back. This will shorten the extensor muscles, and to get an even greater effect, generally what we'll find is that if we internally rotate the thumb, it'll slacken it even further. Then we can just rest the hand by our side so that we're not stressing the shoulder while performing this position. It takes about 1 minute or longer for the area to stay relaxed when we release out of the position. So that's why I'm going to hold it here for at least 1 minute. When a muscle is in slack, the brain neuromuscularly is firing on average about 50 seconds before it can realize that this position is safe. Now that we'll say that it's been over a minute, once I release from the position, the neuromuscular response says, okay, this position is safe to keep the muscle in that relaxed state. And if you were to poke again, you should find that it's softer and hopefully a lot less pain. When you do this exercise, if you find that bringing the hand back and internally rotating the thumb doesn't give a great result, try externally rotating the thumb. Sometimes this is not just a clinically proven science, but sometimes there's an art to it, and you want to find the exact strain of the muscle to make sure that it goes into slack. How often would you do this? If you've complained of tennis elbow and it's been severe and you haven't found the results that you're looking for, I would recommend doing this at least 6 times a day, sporadically throughout the day. And then in a couple weeks, as inflammation starts to go down, you can do this about a couple times a day for maintenance. I hope this can help give you some great relief, and thanks for watching. Take care.